We all have our part to play to stop the spread of COVID-19. By now, you should know and be practicing the safety measures. That means washing your hands frequently, wearing a mask, and staying at home if you don't need to be out. For those who have loved ones visiting from overseas, ensure they adhere to the quarantine protocols. And be mindful that as of August 20, non-residents visiting from the United States, Brazil, the Dominican Republic, and Mexico will be required to obtain a COVID-19 PCR test prior to their arrival on the island. This is Jamaica Magazine, the show with the information you need to know. I'm Adrian Atkinson, your host for today's edition. Stay with us, it begins right now.
The JIS Heritage Competition is celebrating 10 years of youth expression on Jamaican history, culture, and tradition.
Let me tell you about our Bashment heritage.
Jamaica still needs national heroes to preserve our cultural legacy.
Bogo got his men and led them down over the hills to Spanish Town.
Jamaican music to me represents our identity and culture as Jamaicans.
Add your voice and play your part in preserving our national heritage. The JIS Heritage Competition 2020, coming soon.
Good day, I'm Theodore Henry, and this is your JIS News for Tuesday, August 18. The state has extended the quarantine period now in effect for communities in St. Thomas and Clarendon until September 2. Since August 6, Sandy Bay in Clarendon, as well as Bamboo River, Church Corner, and Lower Summit in St. Thomas have been under quarantine. At a press conference Monday, Prime Minister Andrew Holness said the extension became necessary as the authorities were seeing a rapid increase of positive cases in and around the areas under quarantine. Mr. Holness also announced that the curfew hours for St. Thomas had been revised and will now run from 7 p.m. to 5 a.m. the following day, starting August 18. The national curfew, which still applies to all other parishes, remains 11 p.m. to 5 a.m. Meanwhile, public gatherings in St. Thomas will also be impacted by the revised protocols.
Which will be in the new order. There will be no funeral services at churches. Unfortunately, wedding ceremonies would be affected as well. Entertainment would be affected as well, and civic services would be affected. And this is for the next 2 weeks.
To date, the Ministry of Health and Wellness has conducted 300 home visits and collected 700 samples in St. Thomas. Of that number, 89 samples have tested positive for the novel coronavirus, including 45 outside the quarantine area. Scores more have been symptomatic and are now awaiting their test results. Over in Clarendon, Health Ministry personnel have visited 900 households and interviewed over 2,000 persons. So far, 22 persons in the area have tested positive for COVID-19.
Additionally, approximately 20 communities within the parish of St. Thomas have been impacted with new COVID-19 cases. These communities span the entire length of the parish and therefore indicates a sort of community transmission, if you will, that are some epidemiologically linked, others not, and hence the need for a greater level of alertness and concern.
Meanwhile, Health and Wellness Minister Dr. Christopher Tufton says several communities in Kingston and St. Andrew are being monitored due to a spike in the number of active COVID-19 cases. The communities are Duaney Park, Patrick Gardens, Pembroke Hall, Coreyville Gardens, New Haven, the Halfway Tree area, Hewenden, Arlene Gardens, Malines Gardens, State Gardens, Zadie Gardens, Constant Spring, Barbican, Meadowbrook, Havendale, Delacree Park, Olympic Gardens, and Waltham Gardens. Residents in these communities are being asked to exercise even greater care and vigilance during this period. At Monday's press conference, Dr. Tufton said the communities are being monitored as they've shown increases in COVID-19 cases with sources which cannot be traced or linked.
I don't want the public to interpret this as having multiple cases. It really is an issue of cases that are presenting which now requires contact tracing and the possibility, the chances of other persons being contaminated based on the movement of these individuals in these communities is a very real one. And the history of the virus suggests that that is the case.
Still on health, expectant mothers are being encouraged to visit antenatal clinics at the earliest stage of pregnancy. Coordinator of the Program for the Reduction of Maternal and Child Mortality, PROMAC, Dr. Simone Spence, has issued the caution. Dr. Spence says the health conditions brought on or worsened by pregnancy need to be identified as soon as they present, so adequate treatment can be administered to bring about the best outcomes for both mother and baby.
The health system can only do its part once it is that you have sought to access care. So, what we want to do is to have women play that proactive or have that proactive approach in terms of ensuring that they're healthy to be pregnant. And then once you are pregnant, to ensure that you're having your clinic appointments, keeping those clinic appointments so you can be appropriately monitored.
Expectant mothers are able to access these services at health centers without having to visit a hospital. A $52 million virtual training and motorcycle simulation program has been opened in Westmoreland to help reduce road fatalities. Minister without portfolio in the Ministry of National Security, Matthew Samuda, says the program will sensitize participants about the road codes, types of motorcycles, their parts and controls, as well as defensive riding.
Due to these high number of motorcyclist fatalities in Westmoreland, the ministry and its stakeholders have decided to pioneer the first motorcycle simulation program here in Petersfield.
Minister Samuda was speaking at the recent launch of the Outreach and Training Program and the installation of a motorcycle simulator. The virtual platform will provide reenactments of accidents and solutions to avoid collisions. The reality training will be delivered under 4 modules, with the use of virtual reality headsets to accommodate persons who are unable to read and write. The program is being supported by the National Road Safety Council. The Motorcycle Operations Level 1 program will begin in September as part of the curriculum of the Heart Trust NSTA. And finally, persons registered with the Jamaica Council for Persons with Disabilities, JCPD, may apply for benefits on the government's COVID Care program. This applies to persons who have been registered with the Council from March 31, 1973 to June 30, 2020. Successful applicants will access one-off temporary grants to cushion the economic impact of COVID-19. Executive Director of JCPD, Dr. Christine Hendricks, says this grant is available to persons with disabilities aged 0 and upwards who are unemployed or not formally employed. Individuals who have already benefited under the CARE program should not apply. Application is now open online at wecare.gov.jm, and the deadline for submission is now August 31, 2020. Applicants will need to provide their name, address, a valid tax registration number, and banking information. Persons may visit the JCPD as well as all parish offices of the Ministry of Labour and Social Security, the Jamaica Society for the Blind, Jamaica Association for the Deaf, Jamaica Association for Persons with Intellectual Disabilities, and the Combined Disabilities Association. And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.
Whenever you hear the following tone, the Office of Disaster Preparedness and Emergency Management, ODPEM, will be giving information on an emergency situation affecting the island. Please be on the alert and listen to your radio and television for further information. This was a test of the emergency alert system, brought to you by ODPEM.
Coming up, highlights of Prime Minister Andrew Holness's activities last week.
$25 million contract for Spanish Town Road transmission upgrade. Office of the Prime Minister implements COVID-19 measures, and
the date fixed for the taking of the polls, that is the general elections for the year 2020, is therefore Thursday, September the 3rd, 2020.
You're watching Jamaica House Weekly. I'm Anthony Morgan. Last Monday, the Office of the Prime Minister implemented COVID-19 protocols and suspended operations at one of its buildings due to a suspected case of the novel coronavirus. In a release, Permanent Secretary Audrey Sewell said the move was made out of an abundance of caution. The building was closed and deep cleaning activities carried out. The building in question houses limited clerical office operations at the OPM and is not heavily trafficked or frequented by staff or visitors. The space is not linked to the executive building and poses no exposure to the Prime Minister. On Tuesday, Prime Minister Andrew Holness announced that Jamaicans would go to the polls on September 3. Nomination day has been set for August 18, and Parliament was dissolved on August 13. As he made the disclosure, the Prime Minister revealed that protocols were being finalized to keep citizens safe as they vote for their political representatives.
Once that is done, then I will place them in the Disaster Risk Management Act as orders, which means consequences will flow for breaches. It is very difficult. I have been on the road. I have seen it. I take this opportunity to appeal to supporters of both political parties that it is important that politics does not become a cause of the spread.
Still in Parliament Tuesday, Mr. Holness brought a resolution to revoke the state of public emergency across the island. The special security measure, which was operational in 10 of the 19 police divisions across 6 parishes, ended on August 17. The revocation comes ahead of nomination day on August 18. States of public emergency to quell crime were in operation since January 18, 2018. Government has signed a $25 million contract for a transmission main upgrade, which will improve the water supply between 6 Miles and Blake Road in Kingston. Prime Minister Andrew Holness and other government officials signed the contract with M&M Jamaica Limited at Jamaica House on Wednesday.
This project will connect to the pipe that we already laid along the Mandela Highway. It will replace the old mains along Spanish Town Road to Blake Road it is. And this will ensure that the proper water pressure and consistent supply of water can reach the communities along that area and go as far as to central Kingston.
The Prime Minister says the laying of the pipes may cause some dislocation, but new technology will be used, such as directional drilling, to create a tunnel for the mains to be installed underground where possible.
Now, this new main that is laid will last us maybe another 60 years before we will have to do any significant kind of maintenance to it. So we consider this to be a nation-building project.
And that's it for Jamaica House Weekly. Be sure to join us again next time for more of the news stories coming out of the Office of the Prime Minister.
The Ministry of Local Government and Community Development is providing assistance to the nation's homeless as the country combats COVID-19. More than 28,400 meals have been distributed under a special street people feeding program. 3,200 and counting care packages have been provided to assist the homeless with their hygienic needs. Drop-in centers continue to be spaces of comfort and refuge. Since the establishment of a shelter for the homeless in Kingston, more than 500 visits have been made to the facility. So far, at least 20,000 homeless people have benefited from these interventions. In the fight against COVID-19, the homeless are not being left behind.
Ramped up COVID-19 measures, special feeding program for the homeless, and infirmaries get a facelift. These are just some of the major achievements in the Ministry of Local Government and Community Development so far this fiscal year. Let's get the details.
We have seen local government working in this COVID experience. Opening of community bars, taverns, beaches, rivers, all the protocols that was announced in this House, Mr. Speaker. It was the Social Development Commission that went out and did the survey, made the necessary recommendations. Over 35,000 meals have been provided for the poor people of this country living on our streets, Mr. Speaker. We have added a new feature to benefit these people. We have established what we call a soup kitchen for the homeless. This was established at Church Street in Kingston, which I will be opening in a couple of weeks' time. This facility will provide 700 meals on a daily basis, Mr. Speaker, for those persons who are desperately in need of it. This year, we are aiming to build an additional 12 more this year in the parishes of St. James, St. Elizabeth, St. Mary, and St. Andrew will benefit from 12 additional houses for the indigent across this country. We will continue to improve our infirmaries island-wide. The final phase of the $200 million project financed by the National Housing Trust is well on the way. The new administrative building is almost completed. Work is going on in Portland on a new female ward. St. James, a new male ward. Westmoreland, a new male ward and matron quarters. These are well advanced, Mr. Speaker, and will be completed before the end of this current financial year. The demands are growing, Mr. Speaker. In the parish of St. Catherine, no provisions was made. But when we did the survey, we discovered that there's a growing population of homeless Jamaicans in the parish of St. Catherine. What we have done, Mr. Speaker, is that, again, I went to the Minister of Finance and made a request. And we got some money. And out of that money, we are now building a brand new facility in Linstead that was never a part of the original program. We care about poor people. We care about these people, Mr. Speaker. So we are doing everything to ensure that we put these people in place, Mr. Speaker. Mr. Speaker, there's another sector of Jamaicans that the Ministry of Local Government, through the Poor Relief Department, is taking responsibility for. You have many Jamaicans who have been deported and come back home. A lot of them don't have anywhere to go. So what we are now doing, Mr. Speaker, in the member constituency from Central Kingston, there is 47 Ioban Street, where there was a facility. There is a facility that is there. We are now retrofitting that facility to ensure that those persons who cannot go into the infirmaries, that we make provisions for those persons, and this is being done through the work of the Board of Supervision. To further strengthen the accountability structure of the corporations, we have sought the support of the Ministry of Finance and Public Service to establish an audit committee in each municipality. Moreover, we will be receiving technical assistance in implementing a new accounting-based system, Mr. Speaker. And this system is being supported by grant funding through the European Union under the Technical Cooperation Facility. This year, Mr. Speaker, we are not just talking about giving them trucks. The Black River Fire Station in St. Elizabeth, Lucy in Hanover, will be repaired at a cost of $39.5 million, Mr. Speaker. Relief is coming for the firefighters in Ola. Work will commence, Mr. Speaker, on a brand new facility on the site where the original fire station was situated in Old Harbour, and we are expecting that the firefighters in Old Harbour, by the end of this calendar year, will have a new surroundings to work out of. Andrew Holness administration is providing, Mr. Speaker. Mr. Speaker, medical services will be launched in Ocho Rios in St. Anne's Bay. We will provide bunker gears, jars of life-cutting tools, and other equipment at a cost of $248 million to the Jamaica Fire Brigade, Mr. Speaker. We are training 85 new recruits, Mr. Speaker. The local government system, Mr. Speaker, is there for everybody, Mr. Speaker. Under this investment that we have made, Mr. Speaker, in strengthening local government, we have seen more drop-in centers being constructed, more being provided for the poor and the destitute, Mr. Speaker, more fire trucks, more garbage trucks, Mr. Speaker. We have seen where persons, we opened a Rona hotline that was managed by the SDC. And you will be surprised to know, Mr. Speaker, that when we opened the Rona line, Mr. Speaker, more than 5,000 Jamaicans have been calling the line.
An important message from the Ministry of Health and Wellness. What to do if you think you have been exposed or are experiencing signs and symptoms of COVID-19. Immediately call 888-1-LOVE. That's 888-663-5683. In addition, you should stay at home. Don't go to work, school, or any public place. Do not use public transport, and avoid visitors to your home. You may need to do this for up to 14 days to reduce the spread of the infection. A message from the Ministry of Health and Wellness.
The government has implemented a number of measures to allow for the economy to move forward as the country manages COVID-19. The prevention and infection measures cover various sectors. Listen for the plans guiding this new normal.
Our response plan, as you recall, has 4 phases: the inter-pandemic phase, the alert phase, the epidemic phase, and of course the recovery phase. But we are still in the epidemic phase.
Living with COVID means, first and foremost, that we always have to be cautious. We cannot let our guard down. As I like to say in parochial terms, COVID's still a keep, and therefore people must not ever get complacent, despite the successes that we have had. The fact is that as we lift restrictions, there are issues that will have to be confronted in terms of surveillance, in terms of managing the possibility of a greater risk profile. The ministry has been working on a plan in recognition of living with COVID. and the risks that are associated with that. There are some specific things that we have to do and are doing contained in that plan. These include a review of the existing legislation to bring them in alignment with international health regulations, requirements, and the drafting of policies that support infection prevention and control measures at home, in the communities, and at the workplace. The Strategic and Human Resource Review of the Health Emergency Operations Center, EOC, we're here now at the physical space, to increase the capacity to respond to multiple and varied disasters and the documentation of EOC procedures. Creation of some 2,208 posts for community health aides, and they are going to be the sort of army out in the community, monitoring, encouraging, teaching, motivating, handing out brochures, and bringing back information, intelligent information, as to what is happening that may represent a risk in a particular area. Another 500 posts for public health inspectors, again an important development, and training for contact tracers. A big part of our success has been those men and women who go out in the field to take the risk, to test people, to visit homes, and we're going to reinforce that. A review of the organizational structure of the medical officers of health in each parish with a view to enhance the capacity to respond to emergencies will be also an important part of that issue system. Critically also, part of the COVID plan or recovery plan from a public health perspective is the development of a national lab policy, including a system of licensing of labs and requirements for conformity to a national quality standard. And finally, the approach will involve an assessment of the sea and airport protocols. So the idea around ensuring we have the protective gear, the training, if necessary, the expansion of staff, isolation rooms, all the gadgets that are required, because it is in the coming and the going of Jamaicans and non-Jamaicans that contagious diseases can spread. And so we need to review that process and enhance that process. So all contained will be part of a plan, which we will unveil in due course, that will represent the new norm, if you will. And over the next year or so, for however long COVID lasts as a threat, we will engage stakeholders to be a part of offering that solution.
The show has come to an end, but only on your television screen. Join us online on Facebook, Instagram, or YouTube for more features on a variety of issues. Then again, tomorrow at the same time on the same station, we'll have more updates for you. Until then, I'm Adrian Atkinson. Stay safe and stay healthy.
This has been a production of the Jamaica Information Service, the voice of Jamaica.